Today I will discuss about the thyroid gland. Thyroid gland is an endocrine gland which is richly supplied by the blood vessels. It is situated in the front of the neck. On the both sides there are two lobes of the thyroid gland joining by a isthmus. This is the pyramidal lobe. And now the thyroid gland, the main function of the thyroid gland is to regulate the basal metabolism of our body, the somatic and the psychic growth, and plays an important role in the calcium metabolism of the body. So it has two lobed, left lobe and right lobe joined by isthmus and a projecting pyramid above from the isthmus. This is attached to the hyoid bone by levator glanduli thyroidei. Levator glanduli thyroidei by it is attached. So the anatomical location of the thyroid gland is from C5 vertebra to T1 vertebra. So C5 vertebra is uh, the thyroid cartilage. In the mid thyroid cartilage it is situated, and in front it is situated in the 4th to 5th tracheal ring. The base is situated in the 4th 5th tracheal ring, and the apex is situated in the thyroid cartilage, mid thyroid cartilage. Now the weight of the thyroid gland is 25 gram, which is much more larger in case of female than in male, especially in the menstruation and the pregnancy. The size of the thyroid is 5 centimeter by 5 centimeter by 2.5 centimeter. The size of the isthmus is 2 centimeter by 4 centimeter. It is 1.2 centimeter by 1.2 centimeter, and it is situated in second and fourth tracheal cartilage. Now, thyroid is surrounded by a true capsule and a false capsule. This true capsule is situated in the parenchyma, lateral to the parenchyma, and it is underneath the true capsule there is a rich blood supply. So aiding hemorrhage during the operation of the thyroid while removing the true capsule can lead to hemorrhage. So to avoid the hemorrhage, the thyroid should be removed along with the true capsule, to avoid the hemorrhage. But in case of prostate, we see the blood vessels are rich in between the true and the false capsule. Now in case of false capsule, the false capsule is derived. This is the false capsule outer side. So false capsule is derived in the posterior border. It is present. It is derived from the pretracheal layer, pretracheal fascia, which is the deep cervical fascia, cervical fascia. In posteriorly, it is attached to the cricoid cartilage by the ligament of Berry, suspensory ligament of Berry, which is a condensation of the fiber of the pretracheal fascia. So this is about the true capsule and false capsule. Now, what are the uh, parts of the thyroid gland? It has the apex, it has a base, it has a surface, three surfaces: the lateral surface, the medial surface, and the posterolateral surface, and it has two border, anterior border and the posterior border. Now the apex is situated above. This is the apex. The apex is upward and laterally. So what is the relation with the apex? Apex has a superior thyroid artery and the external laryngeal nerve. Superior thyroid artery and the external laryngeal nerve. So this is at the apex, and the apex is situated at the C5 level, cervical vertebra level, C5 level, and in the mid thyroid cartilage. So this is all about the apex. Now coming to the base. In the base, it is situated in the 4th to 5th tracheal ring. It has a relation with the inferior thyroid artery and the recurrent laryngeal nerve. Now coming to the lateral side. In the lateral surface, it is a convex surface. This is the lateral surface, which is convex, and it is related to sternohyoid muscle, superior belly of the omohyoid muscle, sternothyroid muscle, and anterior border of the sternocleidomastoid. So this is the sternohyoid muscle, this is the strap muscle, this is the sternohyoid muscle, which is related laterally. Superior belly of the omohyoid, this is the sternothyroid muscle, thyroid from the thyroid cartilage, it is to the sternum, manubrious sternum. So this is sternothyroid, and there is a sub sternocleidomastoid muscles also, anterior border of the sternocleidomastoid. So it is related with the these four muscles, the lateral surface. Now the medial surface. Medial surface is having the relation with the two tubes, that is the trachea in front and the esophagus in behind, and external laryngeal nerve, recurrent laryngeal nerve, external and recurrent laryngeal nerve. Two muscles are there, inferior constrictors of the pharynx and the cricothyroid, which are present in the medial surface. Here we can not approach this, it is behind this thyroid lobe, so it is on the medial surface. Now coming to the anterior border, it is related to the anterior branch of the, this is the anterior branch of the superior thyroid artery, this was the superior thyroid artery and the external laryngeal nerve. So it is the anterior branch of the superior thyroid artery, which is situated in the anterior border, which is thin, and the posterior border is thick. It is rounded and it separates the medial and the posterior surface. It is related to the inferior thyroid artery, and the anastomosis between the superior and ascending branch of the inferior thyroid artery. So inferior thyroid artery has an ascending branch, and the superior thyroid artery, the posterior branch of the superior thyroid artery. So there is a anastomosis. This is the anterior branch, there was the posterior branch, so there is a anastomosis in the posterior border. There was a parathyroid gland posteriorly and the thoracic duct on the left side. These are related with the posterior border. Now coming to the isthmus, there is a two surface, anterior surface, and behind that there is a posterior surface, and there are two border, superior border and the inferior border. So anterior surface is covered by the left and right sternothyroid muscles and the sternohyoid muscle, anterior jugular vein, and the fascia and the skin. Anterior jugular vein is in the front, and the fascia and the skin all covers the isthmus. Now coming to the posterior surface, the posterior surface is related to the tracheal ring, the second and fourth tracheal ring. Now coming to the upper border there is an anastomosis on left and right anterior branch of the superior thyroid artery, and in the lower border there is the inferior thyroid vein. Now the inferior thyroid artery is a branch from the thyrocervical trunk. Uh, you have to revise this, that inferior thyroid artery has a branch from the thyrocervical trunk. Superior thyroid artery is the first branch of the external carotid artery. The thyroid ema is another artery which is a branch from the aorta. Superior middle thyroid vein is derived from internal jugular vein, drains into internal jugular vein, and the inferior thyroid vein drains into the innominate vein, or the inferior thyroid vein also drains into the left brachiocephalic vein. Left brachiocephalic vein. So this is all about thyroid, and the lymphatic drainage of the thyroid is the deep cervical group of lymph node. Deep cervical group of lymph node. There is a coccus veins also in between the superior and the inferior thyroid vein, which drains into internal jugular vein like this. The nerve supply is mainly the cervical ganglion. So nerve supply is cervical ganglion, which are the vasoconstrictor. Okay, so this is all about thyroid gland.